Newsfirst Newsline with Faraz Shauketaly.
Hello there, good evening and a warm welcome to Newsline Live. Now, the world versus COVID-19. Is Sri Lanka in a serious situation? Has a serious situation engulfed this wonderful land of ours? Let's find out, shall we? My guest this evening is Dr. Rajiva de Silva, who is a consultant immunologist and spokesperson for the Association of Medical Specialists. Very good evening to you, Doctor.
Good evening.
I'd like to point out that I've got a Perspex covering here between Dr. Rajiva de Silva and myself here, and of course Dr. Rajiva is wearing his mask. Now then, Dr. Rajiva, has Sri Lanka been engulfed by a very...
Yeah, it's a very serious situation at the moment, and it's going to get worse.
And why is it now a serious situation?
Because if you look at number one, the variant that is basically engulfing Sri Lanka, it's the Delta variant.
Right.
And if you look at the Delta variant, the way it works, the way it causes problems in other countries, Indonesia for example, Thailand, and even in countries where there is a great deal of immunization like in the UK,
Right.
you can see that it's going to be a major problem in the coming weeks, maybe in the next 2-3 months.
And but in England, the numbers seem to be up, but the death toll isn't really up. It's
Yes.
pretty low. I know one death is one too many, but their death rate is pretty low.
Yes.
How's that? Is that because of the vaccination?
Yes. Now the vaccines, they reduce infections,
Right.
right? They reduce symptomatic disease, but they don't eliminate it.
Right.
And with the Delta variant, you get infected, you get symptoms, but with the vaccines, particularly if you take both doses, you don't die, right? And deaths or severe disease where you end up in ICUs is pretty rare. And now that is the situation in the UK.
Right.
You get infections and it's rising, but the number of deaths and the number of people on oxygen is low. At the moment in Sri Lanka,
Yeah.
we have not yet reached that.
Okay.
But it's going to go up.
The signs are that the trend is going up.
Yes.
So are you saying that according to the trend that we are going to see even more deaths?
Yes. Yes.
And is it fair and square to describe the situation that all hospitals are working at capacity levels?
Many of the hospitals that admit COVID patients are, running at full capacity.
I've seen some images and so on and footage on the news, on social media, wherever. You see these people lying in corridors, under beds and so on. It seems terribly unhygienic to start with. But also one is wondering, should they be in that state when they could be considerably more comfortable in their own homes?
Yeah, I think most people in hospitals, like I think what the images we saw were from 2 quite big hospitals.
Yeah.
These hospitals cater to people with COVID who have more than slight symptoms, more severe disease.
Sorry,
more than slight symptoms.
Right.
These are not patients with a bit of sniffles or a slight cough. They are probably people who have more severe disease. Like for example, the lung is affected, where the oxygenation is reduced, where maybe there is a chance of getting pneumonia and maybe even needing oxygen.
These people are lying on the floor. I don't see any oxygen tubes linked to them.
No, they have not yet reached that level. But they are potentially, maybe they will end up on oxygen.
So if it's so full, doctor, and overflowing in fact, what chances are there of a patient currently lying in a corridor of getting access to oxygen? if that happens?
Well, at the moment, I think we have enough oxygen for those who need oxygen at the moment. But it's quite possible that if these cases increase, we might run into a situation where we don't have oxygen. We have not reached that level yet. As far as the people lying in corridors is concerned, I think they are opening up more wards. Maybe at Kalubowil, I think they are opening up new wards. But there is a limit. Sri Lanka is not a rich country. There is a limit, and we might reach that limit.
Would it help if the army took assisted? There's always the army or the forces always coming to our aid anyway. Would it help if they had large spaces like airport hangar, for example?
Yeah, but it is not just the space. You need the beds. And when you talk about oxygen, you need personnel to basically provide oxygen. And I think a lot of these doctors who work with COVID patients are exhausted. So it is not just an empty hangar. You need equipment and you need people.
You need human capital.
You need
trained human capital.
Yes.
Which brings me back to my favorite theme of the last few weeks, which is education, education, education.
Yes.
An abysmal investment in education by successive governments means that Sri Lanka's university graduates, state ones, at the end you'll only find 30,000 spaces, I think a little bit over now, 40,000 perhaps, and the private sector is 15,000, so it's 55,000. Are 55,000 graduates enough to solve Sri Lanka's problems?
It's not just the graduates. There are other reasons.
There's 114,000 training places in vocational training.
Right.
But the population, the student population, is approximately 360,000 every year, average, 330, 360. So out of that, I work out that if you don't go and do your vocational training, or you don't have a degree, there's about 200,000 people who are not trained in any shape or form.
Right.
Is that figure okay? Can we manage? Or we can't?
Unfortunately, it's not my area of expertise.
No, I know.
Yeah.
But as a professional man,
yeah.
Would you like to see more doctors?
Yes, definitely.
So what's the capacity? How many doctors can this country produce every year?
Well, at the moment, I think it's about 1,000 or maybe even slightly more than that. 1,000, maybe 1,500 with the KDU and so on, maybe 1,200, 1,300.
It's not 2,000.
Not yet.
All right. So leave that as it may be. How bad is the news that the public sector have been asked to come back to work?
Well, it's like this. There are two things here, and you need a balance. On one side, you have the economy, and our economy is not doing well, right? There have been downgrades and so on, so it's bad. So I don't think there is any professional organization, health organization, asking for a total lockdown.
Right.
On the other hand, you have people who are getting sick, and the capacity, health capacity is at its peak. I mean, basically, we cannot go further. So we need to strike a balance. And one thing that is absolutely necessary is to prevent unnecessary super spreader events. That is the basic point. I mean, that can be done. For example,
and what, like example, yes.
Weddings, nightclubs, musical shows.
Cricket matches.
No, cricket matches are okay.
Why?
If there are no spectators.
So 25 people, 26 people?
Yeah, but they are in a bubble.
Okay.
Right? Now, for example, the Royal Thomian will be held in another 3 weeks.
Doesn't that send the wrong optics, though?
Well,
doesn't that, to me, sometimes it smacks of elitism?
Well, now, for example, you have the Olympics. You have the Olympics in the middle of
a country which has 30.7% of their total population vaccinated.
Yes,
in Sri Lanka, we have 12% vaccinated with 1 dose. Japan is 30.7 Both doses?
Yes, but there is a surge of cases, but they are still having it. England, they are having the cricket match. They are having the test series between England and India, right? So in Sri Lanka, we have cricket matches.
But Doctor, in England, the number of vaccinations, the population, it's over 70% of both vaccinations.
Yeah.
So they ain't dying, they're getting ill, and it's not on to compare Japan with Sri Lanka or Britain with Sri Lanka, not even Wales or England or Scotland or even Northern Ireland, because their facilities are far beyond the comprehension of the average Sri Lankan person here.
Right. But now we have had cricket matches, I'm talking about sports matches with various foreign teams. It has not caused a problem in the sense they were not super spreader events. Now, for example, these cricketers are in hotels, they are in a bubble for about 3 weeks.
Okay.
Right? All the players, the staff, they are in this bubble. Right? And they are also providing some kind of finances to hotels. There is some economic activity going there. Okay. Right? And there are no spectators. That is the important thing. If there are no spectators, if there is no crowding, you are not going to spread COVID.
All right. The flip side of that argument is that there are hotels and other establishments that are readying themselves to cater for the side supporters, right? In these places. That's when you read social media, that's what you find out. Which is why, back to my point, that you're sending out the wrong optics. You're telling somebody in the wider population, the wider republic, you're telling them, wear these things, wash your hands, keep your distancing, blah, blah, blah. It's all your fault if you don't do it. And at the same time, you will have a very small number of people to have their way, which is to play cricket or whatever it is. Surely that's just one game, and why risk the rest of the population to be tempted to say, well, if they're playing cricket, the fact that there are no spectators is beyond people.
No, I don't agree with you. I mean, there have been a lot of cricket matches. Now, this is a school game, but there have been other cricket matches.
Members of those teams have tested positive.
Yeah, but they have not caused problems. They have not sort of infected people. In Sri Lanka, there has been no cluster based on those cricket matches. Mm-hmm. They have brought foreign exchange into this country, and we are basically almost bankrupt. So there has been some benefit to this country without causing a problem. When we are talking about local matches, they are providing some employment to some people. So it is not just as if, as you said, an elitist game or an elitist group of people.
Well, I'm going to beg to differ with you, because I don't have the figures as to how many ground staff there will be employed during the period of these big matches and so on. But on a wider picture, what should the government be doing now? The whole business of getting back the public service to work has its own problems. Should they do a U-turn?
Yeah, I think they have changed their policy a bit today. I understand that now they have said only half of the people can come at any one time.
Right.
So they have reduced. I think they have done something, but that is one thing that they can do. But I think the most important thing is these super spreader events, and that also includes protests that are going on in this country. These are absurd.
Well, when you ask all these people to come back to work, you're forgetting the public transport system.
Yes.
The trains are still crowded in the morning.
Yes.
The buses will be. There's no good saying to telling the public the whole lot of almost tosh, which is, oh, we're going to prosecute all these people. Really, I'd like to invite the people who are saying this to come and stand on the Galle Road between Mount Lavinia and, let's say, Bamlapitia, and find out how many police are charging how many buses, because it just doesn't happen. And it's all for hopefully better optics. But the actual fact is, Sri Lanka doesn't have, our public transport system doesn't permit this kind of staggered coming to work and so on and so forth, because we, as you correctly said, we are not a rich country, we don't have the resources.
Definitely it is going to spread COVID. All these events, even coming for work in crowded buses, crowded trains, is going to spread Delta variant. So there has to be a balance, and I think professionals should get together with the government and sort of find out the correct balance.
On that note, on a note of balance, let's find out how we can balance the growing serious situation in the country after taking a look at the headlines for the primetime news this evening. We'll see you on the other side.
News First, Newsline with Faraz, Shauketaly.
The world and Sri Lanka versus COVID-19. Let's talk about vaccination, shall we, with our guest, Dr. Rajiva de Silva. Doctor, tell me, what about all these different vaccines? Are they all, you get the shot and you're done, good?
No. Most vaccines need 2 doses. There is a vaccine abroad which needs only 1 dose, but all the others need 2 doses.
2 doses.
Yeah. Now with the Pfizer vaccine and with AstraZeneca and Moderna, there is some degree of protection after the first dose against the Delta variant, and that is the variant that is prevalent now.
Which is now, you talk about the most serious variant, which is the Delta variant.
Yes. So for example, it's about, the efficacy is about 30% for AstraZeneca after 1 dose, 33% for Pfizer. But the problem is, most of the vaccine the vaccines that have been used in Sri Lanka are the Sinopharm vaccine, is the Sinopharm vaccine. 8 million people have been given 1 dose of Sinopharm.
8 million people have been given 1 dose of Sinopharm.
And I think 1.6 million have got 2 doses.
1.6 million have got 2 doses of Sinopharm.
The problem is, those 8 million people with 1 dose of Sinopharm, they are not protected. Not protected.
Why?
Because these are inactivated vaccines. Sinopharm is an inactivated vaccine.
So which only gets activated when you have the 2?
No. They are killed vaccines where the immunity is not that strong. And you need 2 doses. And the immunity starts to build up 2 weeks after the second dose. That's about 6 weeks after the first dose. So up to 6 weeks, even if you have 8 million people here vaccinated with 1 dose, they are not protected. They will be, say you, on the 1st of August, if you vaccinate 8 million people, they will get protected only in the middle of September, after the second dose.
So, do you think that most of these public servants have got the Sinopharm?
The frontline workers have got AstraZeneca, but all the others have got Sinopharm.
So they should really be not mingling or anything.
Definitely.
They should be like the people who are not vaccinated until 2 weeks after the second.
Yes. And the other important thing about vaccines is, just because you have been vaccinated, even with Pfizer, you can get infected, you can have symptoms, and you can transmit the disease. Say for example, now I've got 2 doses of AstraZeneca.
Yeah.
But I can get infected, I can get symptoms of disease, but generally it would be mild, like fever and a cough.
Right.
And the ability of the Delta virus in my body to infect a person is as great as an unvaccinated person. There is no difference. So even if you are vaccinated, you are a danger to other people.
And this is a very serious situation.
Yes, it is.
I have a question from, I'll take this because it's particularly touching, really. I'll read it out. Sir, I am a 80-year-old female, not vaccinated, yet as I want to get the first dose of Pfizer or AstraZeneca only, not the Chinese vaccine. Please ask anyone related to health services that I interview where I could get this. No one seems to answer the phone anywhere, any place these days anyway. Thank you.
Well, firstly, I don't think you can choose the vaccine that you are going to get.
Right.
That's impossible. That doesn't happen anywhere. Right? Now, there is the Delta variant that is prevalent today.
Yeah.
And If you can't get the Pfizer or the AstraZeneca, you have to take something. You have to have some protection. And Sinopharm, 2 doses, does provide protection. I think it is not very wise for a person to wait till he gets, a Pfizer or a AstraZeneca. It might be too late.
I see. So it's a very serious situation.
Yeah.
And the public must understand that they are unable to choose.
Yes.
There is no choice.
No.
It's what you're given.
Yes.
And in this case, it will be Sinopharm.
Well, Sinopharm is the vaccine that is available, throughout the country.
It's widely available because we've got stacks of it coming in.
Yes.
And therefore, so let's ask you the question that is on all our minds. Who should be in charge of controlling the spread? Is it medical professionals or should it be administrators?
Well, I think the AMS thinks, that is the position of the AMS, that it should be health professionals. The health professionals should have a key role in deciding what kind of measures, what kind of vaccines, what kind of people, where the vaccine should be. All those should be decided by health professionals, right? And of course assisted by administrators, and basically we, that is the health professionals, should give advice, and it should be implemented by other people.
But the medical bits needs to be done with the aid of medical specialists, people who know what they're doing.
Yes.
And talking.
Yes.
Let's take a few questions received from the public. Why didn't the government target and vaccinate the over 60s first and therefore possibly prevent high number of deaths instead of vaccinating younger people?
I think that is a deficiency on the part of whoever decided on this.
But there are cases where people with both vaccinations have older people who have actually sadly passed away.
Yes.
Is that rare? Is that the exception rather than the norm?
It is the exception. I mean, you don't get 100% efficacy against death in real life. That is, it's not efficacy, it is what is called effectiveness in real life. So most vaccines don't have 100% effectiveness against death.
Right.
But it is very rare. They would have had other comorbidities as well.
Let's see. Doctor, why not use the schools, of course, with the required equipment and the manpower, and use the universities if required? I think they're talking about capacities.
Yeah, I answered that question. It is not just the space. You have other things. You need personnel, you need equipment. So you can't build this up within a day or two. It takes time.
In your analysis, Doctor, what do you believe? Do you think that we are going to have to learn to live with this?
Yes. I think what will happen is that this will be something like the flu, right? It will continue for years, and we might have to get an annual jab, right?
Sort of a booster.
Booster. That will happen. Because this virus will mutate, you will get more variants, and our vaccines will be chasing after it. We will have some immunity, and unfortunately we cannot build herd immunity. That is, you need about 90% of the people protected, right, to have herd immunity, particularly when the what is called the R0 value goes up. And none of our vaccines, at least the inactivated vaccines, cannot provide that because the efficacy is low. You need a vaccine of maybe 95%.
Yeah.
If you have that kind of vaccine, you can immunize 90% and have herd immunity, along with, of course, infections to get immunity. But a vaccine with an efficacy of 50–60% will never provide that.
I think we can take this one as well. The whole effort of the vaccination drive will be a total waste due to bad planning, timing, and of reopening without allowing adequate time to develop the immunity. Yes, it's the economy and the daily wage earner, but is it at the expense of human lives?
That's a very difficult question, right? So certainly opening up the economy will basically condemn some people to death. That will happen.
That's the fact.
That's a fact.
However sad, but it's
however
a fact.
sad. So basically you have to strike a balance. So you have to open the economy, maybe you have to go for work, but you have to have your personal protective equipment on, you have to wear your mask, one particular thing, don't eat with others. Right? That is one way of spreading. That is one way of spreading that happens in hospitals. For example, there was one study in Kandy where they examined the people, the healthcare workers who had got infected. Only 2 out of, I think, about 200 people got their infection from patients. Right? They had been wearing all the PPEs, but they used to eat together.
Yeah.
And that is why the infection was spread. So we have to be careful. Now that's why, for example, I am wearing a mask.
Yeah.
And I didn't drink this.
Yeah.
Because I had to take my mask off to drink this.
Right.
So, which I shouldn't do that. Basically we should not eat together unless it's at home.
Which is your own bubble.
Which is your own bubble. So that's why I say you don't go to weddings, you don't go to pubs, that kind of thing. And I think people of this country should think of others as well, have a sort of a civic consciousness. You're not just only protecting yourself, you have to protect others as well. Unfortunately, that is lacking in this country.
I had a viewer on the telephone who lives on Marine Drive, luckily it's the sun, but the caller told me that come evening time, it's party time on Marine Drive, and there are lots of cars congregating, lots of clusters of people, hardly any masks, and they're having their teas and whatever it is. Are they gambling with the whole business?
Yeah, not only are they gambling with their lives, they're gambling with other people's lives. So that's what I said, you have to work with responsibility. That is something lacking in this country.
Responsibility. We need that.
We need that.
Rather than shifting the blame onto the police.
We are always shifting the responsibility on someone else, the government, doctors, whatever it is. In this situation, we have to be responsible. We have to be responsible.
And be fully aware.
Fully aware.
Well, we've run out of time. So, Dr. Rajiva, thank you very much for your observations and your advisories. And I hope that the Republic will take doctors' advisories to heart and practice, which is what we all need, don't we? Thank you very much, Dr. Rajiv, for being on the program. That's the way it was on Newsline Live this evening. It's now time for the primetime news from Newsfirst. Take care, good evening, and God bless you.